Welcome to LunaSpeaks Live. This is July 26th, and we're here with Dr. Matt Rushford. He's an infant and prenatal chiropractor practicing out of the Burlington area. He's also the author of a book, Born Broken, Depathologizing the Human Condition. We're super happy to have him here. So thank you so much for joining us.
Thank you, Shayna. To those of you who are watching now or picking this up later on, you're probably aware of the work that Shayna's doing with awareness and education and empowerment around all sorts of issues around motherhood and womanhood and family, childhood. So thank you again for all of your work, Shayna. So Shayna asked me to talk about prenatal chiropractic for kids and pediatric chiropractic. And
beautiful.
Usually the first thing I need to do is to kind of clarify where we're coming from with this, because as a chiropractor, I work in a field where most people's experience of chiropractic has to do with two things. The treatment of pain, like back pain and neck pain, and really typically pretty forceful adjusting techniques, popping and cracking. And that's really only one narrow kind of niche of chiropractic in terms of technique and clinical focus. There's a really broad spectrum of chiropractic clinical approaches, both in terms of how we adjust and who we adjust and why we adjust. For me, I've been a pediatric chiropractor for 25 years, and for the most part, I have focused my entire clinical practice on just seeing kids and pregnant women. And I'm one of the few practices in New England that has a focus that's exclusively in that demographic, and I'll talk about why I feel that's so important. So chiropractic in reality across the entire spectrum is really a holistic healthcare field that has a really simple objective, and that is to enhance the functional and structural integrity of the spine. And that's what we do. And whether a chiropractor is treating back pain or whether they're treating a 3-day-old baby, the objective is really the same. We're trying to make the spine healthier, and we're trying to make the spine healthier because the spine houses the central nervous system. And if the spine is not healthy, structurally or functionally, that disrupts the nervous system, the central nervous system, and the central nervous system controls everything. So if you have an obstruction at that level, that central level, then it's impossible for your body to work right, because your central nervous system controls the entire body. And so another problem with the CNS is that there's no sensory nerve endings there. So if you have a distortion in your spine, which is disrupting the flow between your brain and your body, you're never going to feel it. Eventually you may feel some kind of a side effect of pain or discomfort or some kind of body dysfunction, but that may take years and years to happen. And if that's happening to a child, why would you want to wait so long? And the dentist did a great job of educating patients about this, because 100 years ago, a good dentist was known for having a strong forearm and a quick wrist, because all they did was wait until people's teeth rotted and then they pulled them out. And if you went back 100 years and you told somebody, yeah, I'm taking my 3-year-old to the dentist, they would say, why are you doing that? Did they fall and break a tooth, or did they have tooth rotting out already? And you would say, no, I take them to the dentist because, if you take care of your teeth before you have problems with them, then you get to have better teeth later on. You get to keep more of your teeth, and they last longer and they work better for you. And now we know that proper oral hygiene and dental hygiene is a big factor in internal body health as well, cardiovascular health, digestive health, because it's really the entryway into the inside of our bodies. So if we have all these problems and infections happening in our mouth, that can lead to problems inside our body. So now dentists are kind of teaching people, hey, you don't want to just take care of your teeth early on because it helps you keep your teeth. You want to do it because it helps your heart and your stomach and your intestines and all these things. So we bring kids in, and just think about this. We bring a child who's 2 or 3 into a dentist, and all of the teeth that they're caring for are going to fall out naturally, normally. All the ones we're taking such meticulous care of, they're going to fall out. And yet we do this. Why? Because we've been educated that early prevention and proactive care pays off in the end. And it's much easier to stay ahead of something than to catch up to it. And those of us who grew up in a time when dental hygiene was, the education wasn't as good, we can attest to the fact that, you really do pay the price later on if you don't take care of that part of your body. Now compare the importance of your teeth to the importance of your central nervous system. You can lose all your teeth and still be pretty healthy. Harrison Ford lost all of his teeth, all of his upper teeth in his first acting job. He's in a Western and he had a gun and he fell down some stairs and it was his lower teeth. And that's where that scar comes from that he's so well known for. It's from his first acting job. And he had a really bad union dentist. And that's why he has that kind of crooked smile that he's known for. So really, in terms of dental health and keeping all of his original teeth, Harrison Ford has pretty bad dental health. But he for a long time, he was the #1 paid actor in Hollywood. And it really speaks to the ability of being pretty functional, even if you don't have great dental hygiene and dental health. And then you take another actor, Christopher Reeve, who had a similar accident, and he fractured, instead of his tooth, he fractured his second cervical vertebra in a horseback riding fall. And as a result, he had similar damage to his spinal cord. And the difference is Christopher Reeve was paralyzed. He never acted again. He might have acted, but he called himself the president of a club to which he would never want to be a member. And he died famously prematurely. And that gives you a feeling for how disparate the relative importance in our bodies of our spines versus our teeth are. And yet we take really good care of our kids' teeth, even when there's no problems with them. And so we should really take similar care of our kids' spines, even when there's no problem with their backs or their spines. And so this is the kind of education process we're trying to get out to the public, is proactive, conservative, preventive spinal care for kids. And does that make sense, Shana? Yep. Okay, good. So one of the biggest hurdles we have to address is the picture people have of chiropractic, which is somebody grabbing a neck and twisting or popping or cracking, really violent maneuvers with a little baby, a brand new baby. And that's a real problem for a lot of people who are trying to understand early preventive pediatric chiropractic. And the reality is that we would never do any kind of adjustment like that on a child. I don't even do that kind of adjusting on adults anymore because we found techniques that are much more effective, or at least as effective, with a fraction of the force and no violent movements or twisting or popping, just little light touches. And in fact, I do pretty similar amount of force to the rugby players that I adjust as I do to the newborn babies that I adjust. It is not necessary to twist and pop and crack. You can, I'm not against those techniques. We just found that using a gentler technique got more done with much less invasiveness. And if you could just see an adjustment of an infant by a really experienced pediatric chiropractor, you really would have zero issues with, in terms of fear, with a baby being adjusted. Because when I'm holding a child and I'm adjusting it, usually the person can't even tell the baby's being adjusted, because what I'm doing is I'm really using the baby's own natural movements and breathing, and all I'm doing is sort of directing and guiding the forces that the baby's generating into more focused realignment and adjustment of the spine. So I'm not going in there and trying to move and adjust or twist or pop or push or, change anything in terms of the baby's body. What I'm doing is using the baby's own self-adjusting innate capacity and directing that in a way so that it's more highly effective. And so I usually tell people, you'll put more force into a baby's spine taking it out of a car seat than I will in a chiropractic adjustment. It is incredibly gentle. And sometimes I even have to tell parents, I had to convince them that I actually did something because it's so light and so gentle and so non-invasive. But the results are really quite remarkable, and that's why we're still in business, because if we don't get the results, we don't stick around. And I've been doing this for 25 years, and believe me, I'm not a very good salesman. We don't have any slick gimmicks in our office. It's a mom and pop practice, and it is built 100% on results. That's the only thing that we go on. And it's what's been keeping us going for a quarter of a century, and practices all around the world just like ours. And in chiropractic in general, there's so much skepticism about it. You've heard of the placebo effect. We have the anti-placebo effect because a lot of people come to us convinced that what we're going to do is not going to work. But they've been forced there by their wives or their sisters or somebody. Just try them out. And they come in, they're like, I know this isn't going to work. I'm going to try it anyways. And, if we didn't get results with people like that, we would not still be around.
Can you describe to us some of the results that you see, especially with infants?
Sure. First of all, babies love getting adjusted. I just saw a baby yesterday, and the mom brought the baby in. It's really colicky. It's a classic situation. Her hair is sticking up. She hasn't slept in 2 weeks. She's got the crazy eyes that any parent would have if if their baby's not happy or sleeping well, nursing well. And she brings the baby in, and I swear, I think she almost brings the baby in just because of how much the baby loves being adjusted, because as soon as I grab that baby or hold it, she looks in my eyes and she just melts. And by now, after the first few adjustments, she knows what's happening, and she's already experienced the kind of easing of stress and tension that she experiences from these adjustments. And, I think she almost looks forward to it. And so she associates, I don't know, my shirt or my face or something with that. And the response is immediate. And, the first time I adjusted that baby, again, this is a colicky baby who, and I see a lot of kids for colic, which is just a baby who's crying for extended periods of time, and nothing is consoling them, not changing a diaper, not nursing them, and not holding them. And so she came in, it was 2 weeks of straight crying, almost nonstop, almost no sleep. And after about 5 minutes in the adjustment, the baby had kind of just melted into it and was just sort of really calmly, almost meditatively gazing at my eyes. And the mom said that's the first time she stopped crying in 2 weeks. And that's a really common, and this is just from the last person I saw today, yesterday. So babies who are just struggling in terms of colic, I see a lot of kids with reflux these days. I was telling a patient, probably 1 out of every 4 of my pediatric patients is on prescription, comes to me on prescription reflux medication. And this is an explosion in terms of what it was like 10 or 15 years ago. And probably more than half are experiencing some kind of a reflux. Half to 3/4 of my new pediatric patients are experiencing reflux issues. So that's a really big issue. And a lot of times the nerves that go to the digestive organs from the spine, that area of the spine is completely compressed and stressed out. Maybe it's from the birth process. Maybe it's from something that's happened afterwards. But it's really important to understand that even brand new babies can have a lot of stress. And sometimes it's just from being born. And that's your first experience in life. And if it is, it can really imprint a persistent protective adaptation. And our spine is our primary place where we protect ourselves. And so if that adaptation is to a stress that's either repetitive or intense initially, our nervous system can get onto a feedback loop, and then that stress is kind of stuck there. And it will stay there and become more and more and more embedded over time unless it's disrupted. And the earlier it's disrupted, the less embedded it becomes. And that's our job as chiropractors, is to get in there early and make these small corrections to these early patterns that can be disrupted, and the body can return back to its normal state. And then there's a clear communication between the brain and the body, and that area that goes to the stomach or to the intestines for gas, constipation, reflux, colic, all of those things often are interconnected. And so those are things that a lot of kids have experience with in terms of just feeling much happier and having a better state of health. Another one is ear infections. We see a lot of kids with ear infections. And I will say it's becoming a slightly less of a sort of explosion in terms of frequency. Now that pediatricians are starting to back off, I mean, just a little bit on antibiotics. And they're giving parents a chance to go through a cycle or two of ear infections and let the body fight it off itself. And I'm starting to see a very slight kind of decrease in the frequency of ear infections in patients coming to me. I think partially because we were so over medicating kids. I had one little girl who was brought to me, and she was 3 years old, maybe 3, and she came to me in the middle of her 16th ear infection that year. So just try to wrap your mind around that. 16 ear infections, and for every single one, she was on a round of antibiotics. And what we know about antibiotics is that they do a number on the whole gut, and they really clean you out. But they also apply a Darwinian pressure to the bugs that are there, so it really predisposes children to recurrent ear infections and recurrent infections of other kinds. So it's a really tough thing for kids to have to deal with. And if there's a natural way to help boost the immune system and give the kid a fighting chance against those bugs, then, why wouldn't you try it? Because antibiotics, I'm telling you, it should be the absolute last thing that you try with your children. And for a lot of years, it was really the first thing that parents really believed that they should try. And it was the first thing that pediatricians were going for as well, kind of on this assumption that, antibiotics are great, right? They save lives, so let's put them in there and just see what happens. And it's really kind of a misapprehension of, I think, of pharmaceuticals and medicine in general. We go through these cycles a lot. We discover something that's really good, and then we basically treat it as if it has no downside. And eventually, right now, antibiotic-resistant bacteria it kills more people every year than AIDS, and it's predicted to have 10 million yearly deaths by the year 2050. So this is a huge problem, and chiropractic has been situated in a place that really could have been a really effective and natural intervention for these things if we hadn't gone so crazy on the antibiotics. So that's another thing that kids have found some relief for. But again, what I want to stress is that I'm not treating ear infections in my office, and I'm not treating colic, and I'm not treating any of those things. When a child is brought to me, I'm not assessing them for colic. That just happens to be what's happening that's really, maybe concerning the parent or appearing to be giving the child some problems. I'm treating the child for assessing their spinal, structural, and functional integrity. And I'm making sure that as their care proceeds, that integrity is improving. And I know that if I can do that, then the communication between the brain and the body is being enhanced, and the baby's body is going to be healthier. And so that's important, because treating symptoms and treating illnesses and diseases and creating an outcome assessment protocol that's based on the alleviation of those things is a really dangerous way to treat patients, because you never know whether making somebody feel better is actually making them better. Because sometimes making them feel better is the result of turning something off that their body was trying to create. And it's not uncommon for an increase in health to result in an increase in symptomatology temporarily. And that's an important part of a healing process sometimes. And if you're basing your outcome on a symptom going away, then you can really disrupt people's health. So the good thing about chiropractic is that we have an outcome assessment that is symptom independent. So we don't have to rely on how people feel to determine whether it's working or not. We can prove that it's working based on objective clinical parameters like range of motion, spinal stress profiles, equilibrium, balance, and all these objective standards that can be measured. I can show them to the parent. We can show them to our patients. We can demonstrate increases in range of motion. We can demonstrate decreases in stress. It's measurable. It's observable. It's demonstrable. And that way we know that every single child we adjust, I should probably get some water, is getting healthier as a result of the adjustment, as long as we get positive post-adjustment responses. Then we know that baby or that child or that pregnant woman is healthier after the adjustment. And that's the huge thing about being a chiropractor, is that every single patient in my office walks out healthier than when they walked in. And that's pretty amazing.
Do you want to grab that water?
Yeah, can I? Just give me a second. Okay.
And so during pregnancy, it's known that a whole host talking about medical issues, but more like emotional issues, emotional challenges. Sure, there's the influx of hormones and there are those chemical changes that are occurring, but it also sort of ties a person back into their entire history. So anything they might have experienced has the potential to really come forward during that time period. So I'm wondering how chiropractic care can positively benefit women who are pregnant.
Well, pregnancy is probably the most important time in a person's life to get adjusted, whether you're the baby or whether you're the mom. We've all been babies before. And, it's a real 2-for-1 deal. We don't charge double for it, but you kind of get double the benefit. The nerves that we're clearing are partially nerves that are going to help the baby develop properly. So that's an important element. In adjusting pregnant women, we're doing the same thing we're doing with all of our patients. We're enhancing the structural and functional integrity of the spine, and thus enhancing the clarity of communication between the brain and the body through the spine. And if there's any disruption there, it's going to affect that mom's ability to grow a healthy baby and to give birth to a baby as naturally and effectively, safely and optimally and orgasmically as possible.
So the thing is that a lot of adults, like when you were describing earlier, the way that it becomes embedded in the body, the psychosomatic symptoms become embedded in the body. So here we have an adult who's pregnant with a newborn who doesn't have the same type of experiences, life experiences that their mom has. So how do you help sort of differentiate the newborn's nervous system?
I lost you there.
Newborn who hasn't even really developed their layers.
Well, I missed the very last part of that question, Shayna, but
how do you as a chiropractor help differentiate between the adult who has already developed all sorts of layers on top of their initial impacts or traumas to the body. Whereas there's like an infant or like a fetus who hasn't even been born yet and hasn't developed those layers.
Well, we're not making a distinction between the two. The mother baby are a duo, and they're in a kind of a dance during pregnancy, and I think to some degree, at least the early phases postpartum, it's a mother baby duo. It's that neurologically, it's that on a lot of other levels, I think. So they are going through this process together, and I don't know that I really make a distinction between the mother, and she has a history there, but the baby has a history too. And to be honest, I have always felt that, a lot of babies, maybe all babies, come into this world with a history that seems a lot longer than 9 months. And so a baby has a history and the mother has a history, and all humans that are interacting with each other also have their own histories and their own layers. Granted, the baby's layers are hopefully a lot less dense, but it's still a continuum and a dance that they're engaged in together. And so with a systems approach to therapy, what you recognize is that we're all in a relationship with each other, and enhancing any one part of the system enhances all parts of the system. And that's really, I don't have access to the fetus's nervous system. I don't adjust the baby through the mom's belly or anything. And so what we try to do is enhance the mom's nervous system. And usually we're talking about, a nervous system that has probably acquired a significant amount more layers, like you said. And so that's the place to go in terms of enhancing the overall relationship system, is to make sure the mom is as clear as possible. And so, yeah, I mean, that's our approach is to try to help make a healthy baby by making a healthy mom. Although I'll also say that our optimal model in chiropractic is for mom and dad to both get adjusted for as long as possible before conception. And we'd like to see a year. That's kind of our perfect world model, is mom and dad are both getting adjusted for a year before they conceive a baby, a healthy sperm and healthy egg. And that's a good way to start that relationship, that process, in terms of having an optimally developing mom-baby duo. But in terms of, the other benefits to prenatal chiropractic, I mean, most of the moms who see me, once they've given birth, say, either if they've had a kid before, they say, "Oh my God, I wish I had known about you with my first or my second, or my first or my second." Or they say, "I can't believe everybody doesn't do this." Because it's, again, there's no side effects. It's just 100% upside. It feels great. We've got a special table, a prototype that we built in our office where moms can lay face down. And that is, indescribable to moms. I tell most of the moms that I'm going to put a separate table like that in the office, and just put a parking meter. And you just swipe your card and stay there as long as you want, because they don't want to get up. Unless you dig a hole in the sand of the beach, you don't have a lot of opportunities in the third trimester to lay face down. So it's a nice experience in that sense. But the adjustment itself, most people, we always say we make sure our patients write their check for their adjustment before their adjustment, because afterwards they're in such a kind of a relaxed and meditative state that we get a lot of checks that are like, that's got like a little heart in the money part, and then like their signature on the where they're writing out the numbers, and it's all discombobulated and mixed up, because people kind of are in a pretty relaxed state. So, but one of the biggest things about pregnancy and chiropractic is simply that women who are getting adjusted throughout their pregnancy have labor times that are on average about half that of the national average. So I know I'm kind of burying the lead there, but partially because, we have no way of guaranteeing how any particular birth is going to go. So I always have a lot of caveats with that statistic, but it is true nationally, and it's true in my office. In my office, the average labor time is a little under 6 hours, and the national average is 12 to 15. And I hesitate to mention that. I mention it because I think it's indicative of the tendency of chiropractic to allow women's bodies to give birth just generally more efficaciously and just kind of without as much obstruction or difficulty. I don't believe that a faster birth is a good goal or a shorter labor because I've seen too many labors that were really, for women, really terrible, but not because they were long. And I've seen labors that are really long and were ecstatic. So I always tell, pregnant women in our first consultation, I say, we tend to have very short labors in the office, but I'm telling you, you don't want a short labor. And that's always fun to tell a mom because they usually, I feel like I'm going to get slapped at that moment. But it's true. And when they hear my explanation, they usually agree. You don't want a short labor. What you want is a wonderful labor. And if it's a wonderful labor, you won't be concerned about how long it is. And quality is what it's all about with giving birth. It's not about quantity in terms of the length of time. And like I said, if you're having a really deep, connected, spiritual, orgasmic birth, you don't care if it's long. If you're connected and you're not afraid and you're not traumatized, that's really what you want. And that's really where we put our emphasis in terms of guiding women through their pregnancy and their birth, is to help them have an optimal birth. But the truth is that women biologically are probably sort of, the template is probably for a birth process that's about 1 to 3 hours. And that's what most of the studies on, hunter-gatherer level societies have shown, that that's about the average labor time for those women. And our women have the same bodies today as those women did then. Evolution doesn't move that fast. So we have the same capacity to do that. And so that's why I think that shorter labors in general, if you have a population of women who are having shorter labors, it's probably a movement towards a biological norm. And again, it's not necessarily a goal. We want to have safe births, safe, healthy babies, and untraumatized mothers and connected families. That's what we want. But it's also likely that that's going to be happening within the template of not a 50-hour epidural C-section type experience. Not that that's bad. It's just I think most women would be very happy if we moved towards the former and away from the latter. So what else can we say? How much time do we have here, Shayna?
We have just about 5 to 10 more minutes.
All right.
And I would appreciate it if you could define some of the terms that you've been using pretty regularly throughout this conversation, especially one term that sort of has a little bit of a hype to it, especially in mainstream literature.
Oh. I lost you there for
Please
that
define
part.
what that means and how it applies to your practice.
Well, I missed the part you wanted me to define.
Or orgasmic birth.
Orgasmic birth?
Yeah.
Orgasmic birth is, it's the best kind of birth. It's when a woman experiences a real ecstasy when she's in the process of delivering her baby. And I've had patients who have experienced it. It's a real possible experience and potential experience for women during the birth process. And I think the important takeaway with orgasmic birth is, first of all, it's just that's out there, that's a potential, it's a possibility, and it's a real paradigm shifter for women in terms of what they've been taught that birth looks like. And so when I teach birth classes in my anatomy courses, I show the video of the orgasmic birth video, and I show a few videos of women having ecstatic experiences while they're giving birth. They're smiling and they're laughing and they're in an elevated state of ecstasy. And they experience, they describe the experience later as something similar to an orgasm. And I don't think it's good to set that as a standard. I just think it's good to put it out there as something that's a potential for women to experience something that is in that direction of connection and positive experience, as opposed to what they're taught birth is about, which is exclusively horrifying. And so that's the value of that kind of introducing that kind of reality that is out there and that people experience. Not all women experience this, but it is something that speaks to the potential that women have to have births that are not horrible and traumatic. And every woman who grows up in the United States, at least, is pretty much taught that birth is pretty much the worst thing that will ever happen to you. It's the biggest catastrophe that will ever happen. And it's understandable that women are terrified of pregnancy and terrified of what pregnancy means, which at the end is they have to give birth. And it really is it's a sad thing that it has to be that way. It doesn't have to be that way, but it's a sad thing that it is today. Before we finish, I just want to say one last thing, which is the 4th trimester, because that is maybe the most important time for a person to get adjusted is when they're a pregnant duo. But the most important time for a mom to get adjusted is actually after her pregnancy. And it took me a long time to take this in, because as a man, we look at childbirth as the most amazing thing that any human can ever do. It's like a superhuman thing. And so when women started telling me, yeah, I mean, childbirth was hard, yes, but after the baby was born, that was the hardest part. And initially I'm like, oh, dear, you don't really understand. You can't be serious about that. You must be misremembering your birth or something. And eventually, I had to let it come in and come in the idea that your postpartum period can be the most difficult by far, much harder than actually delivering a baby, because the baby, this is from the voices of women, by the way, not from me. I'm just relaying this, that birth has a beginning and an end. As difficult as it may be, it has a, several hour time period, and then it's over. But the postpartum period has a beginning, and then, it seems to go on forever. And I've heard women say the silence is deafening, because pregnant women get a huge amount of attention and support and adoration. Oh, you're glowing. They want to touch your belly. People are visiting. You're having showers and parties and presents. And then after the baby comes, the mom's got the hair sticking up and her boobs sticking out, and she hasn't slept in 3 weeks. And, she's, her pelvis has just gone through a train wreck, and nobody's around. People are not as ready to come and visit and support her. And a lot of times her partner, it has to go off to work quickly. A lot of times she has to go off to work quickly. And we do not have adequate maternal leave. We don't have adequate paternal leave. And the support in our communities and our structures for breastfeeding and everything around postpartum is really inadequate. And it can make life a real nightmare for new mothers at a time when she should be bonding and having this magical time with her baby. A lot of times she's physically incapacitated, and she's going through an emotional and mental roller coaster that is really difficult for people who have not been through it to understand. And as chiropractors, that's where we can help. We can do so much to help a new mom to go through that experience with more support, if on no other level than just putting her back together again structurally, so that she doesn't feel like she's just been thrown off a building or been in a train wreck, and helping her to be physically and structurally sound so that she can meet the challenges of new motherhood. How are we doing for time?
Yeah, we're getting pretty close to the end, but it is interesting how the structural alignment and its impact on the center, its balance of hormones, which can help enhance fluid states of mood in the postpartum period. Yeah, I think we're kind of wrapping up right now. Is there anything else that you'd like to say? Any last words of wisdom or advice for anybody who's listening to this episode?
Well, all I'll say is that, chiropractic care is something that's it's easy to get involved with. And just an initial visit with a good family chiropractor is something that's an easy way to just kind of get a feeling for or whether it's the right approach for you. So yeah, I don't have any final words of wisdom.
Well, what about where we can find you? What are your, how can we reach you?
Yeah, so, our office is in South Burlington on 1 Kennedy Drive, which is the intersection of Kennedy and Dorset Street. So it's pretty much right off the highway in Burlington, very easy to get to. My wife sees all of the adults, and I see all of the babies and the pregnant women and the postpartum, and I do all of our initial exams as well. So I'm the exam doc there. So, we're easy to find. You can go to our website, rushfordchiropractic.com, and get all of the information you would need. Most people do that these days. They go to the website or the Facebook page, and they kind of check you out first. We also have an online appointment system, so you can just, if it's 2 o'clock in the morning and you're surfing the web, you decide, hey, I want to try out the Rushfords. You can just make an appointment at 2 a.m. immediately. You don't have to call anybody or talk to anybody. You can just make an initial appointment. We have them 5 days a week, and the initial visit is really comprehensive. We'll do a comprehensive history, a consultation, kind of talking about what your specific, what you're looking for, what you're hoping to get out of this interaction, and then a full spinal exam, either for you or your child, and then an adjustment the first visit, which not all chiropractors do, but we like to, because usually after the first adjustment, we can really show and the person can feel the difference. And that's a big selling point, which is why I say we make all of our clients on results. Because again, I don't have a sales pitch. So, I don't, a lot of chiropractic offices have really well, it's sharp, in terms of, how they run their practice management, and us, I'm a country doctor. So is my wife. Our dog is sometimes around the office hanging out, or a kid, or, with a pediatric practice, there's babies everywhere and diapers, and, it's a little village there. So we don't have any, any slick sales things or long-term, sign up for a year, the first day kind of thing. But on the first visit, you'll get a full history consultation. You'll get adjusted, and then after the adjustment, I'll sit down with you and go over everything we found and talk about what kind of care plan I would recommend, or we would recommend for you. And our model is one of we just want to have some kind of consistent, conservative care plan. We're looking at the long-term goals, so we're not as concerned with the intensity of care, or 3 days a week for 6 months or a year. We can get the job done with a flexible variety of different kinds of care plans. The big idea is, especially with kids, is we want to have them get on regular checkups over time so that we can stay ahead of anything that comes up. And if we do that, I'm telling you, pediatric chiropractic care, it's really conservative. It doesn't take a lot to keep a kid healthy, but it takes a lot to get an adult back to health. And I don't want to do that. It's terrible. That's why I don't adjust adults anymore, because, it's a hell of a job to take a 40-year-old and try to get them back to where they were when that initial subluxation happened, back when they were at birth or in the first 3 to 5 years. Let's avoid that.
Well, thank you so much for sharing your passion with us and all of your knowledge. It's really great to hear about prevention, really, just even from this perspective of an adult who has suffered a lot of impact to the body and, is speaking from that place. If I wish my parents had thought or known about that kind of work, maybe my jaw clenching would, have been alleviated at an earlier age,
Sure.
so
Yeah.
on. Um, well, thank you again. So,
Yeah, thank you, Shayna. Thank you for all you do. You're doing great work out there. We are so grateful to have you out there doing all of these things. The fest that's coming up in, is it October?
yeah,
Yeah,
October 6th, Birth
October 6th.
Love. Actually, we've changed the name, we shortened it, so it's Be Love Family Festival, October 6th with
I love
Myra
it.
Flynn. And yeah, we're looking forward to it. Hope to see you there.
Yeah.
And if you want to learn more about Dr. Matt's practice, you can visit him at rushfordchiropractic.com. And there will also be a link below in the description to this video. So thank you so much.
Yeah, thank you, Shayna. Take care. God bless.
Take care.